I just needed to share this because who knows how many other people's lives it could save. I don't think as women we realize that the biggest killer we have today is actually heart disease. I think we think that happens to men, it's not such a big deal for us. However, it kills more women than all the cancers combined. And why I think it gets missed is two reasons. One is our symptoms are different to men. So we have profound fatigue, shortness of breath, dizziness, nausea as how we would normally present. But also, we're only testing cholesterol, which is usually looking at your LDL cholesterol, which for me isn't giving the full picture. Now, the reason I'm thinking about this is I've been analysing the data from the White Genes girls. As part of the White Genes course, you actually have the ability to do blood tests, and if you so desire, you can do a tailored blood test where you can look at any areas of health that you would like. So one of those areas is your cardiovascular health. Now, the woman that took advantage of this, it's been staggering to actually collate all the data, because what I've noticed, and I see this in clinic as well, is that you may have normalish or just slightly elevated LDL levels, which is normally called the bad cholesterol. And yet your levels of what I call more atherogenic forms of cholesterol, which is ApoB, for example, can be staggeringly elevated, and none the wiser were you unless you did this test. And what I've noticed is that a lot of women have elevated levels, particularly when you hit perimenopause and menopause, when we are at higher risk of cardiovascular disease. When I see this, I really encourage women to then go off and get a referral for a calcium score, which is a scan of your heart area to see whether there's any calcification. One of the ladies who has done this actually asked her cardiologist when she had her scan what would have been the result if she hadn't have done this. And his words to her were, "You would have had 1 or 2 weeks left." That was it. And this is something that I see so often. And I'm not someone who likes to do the scare tactics, but I am someone who likes to spend time in the preventative space, because when you know this, we can fix this. We can prevent things from occurring. So this is just one area of health, but it is the most important area for women in terms of survival rate. So I just needed to share this because who knows how many other people's lives it could save.